Ever wonder what the state of healthcare was like before the pandemic hit? Sit back and let's journey together into the world that was. Before the pandemic, the global healthcare landscape was a complex tapestry of triumphs and challenges. On one hand, we had significant advancements in medical technology, innovative treatments, and life-saving procedures. However, on the other, there were substantial roadblocks that hindered the delivery of effective healthcare to all. One of the most pressing issues was accessibility. Many people, particularly in low to middle-income countries, struggled to access basic healthcare services. Even in some of the world's wealthiest nations, there were pockets of society where healthcare was simply out of reach. Factors like geographic location, socioeconomic status, and even age could determine whether an individual could access the care they needed. Closely linked to accessibility was affordability. For many, healthcare costs were prohibitively high, making it difficult for them to seek out care when they needed it the most. Out-of-pocket expenses could lead to severe financial strain, and in some cases, push individuals and families into poverty. Quality of care was another significant concern. Variations in quality were evident not only across countries but also within them. Some regions boasted state-of-the-art facilities and top-notch professionals, while others grappled with outdated infrastructure and a shortage of skilled healthcare providers. This disparity in quality often meant that the level of care a patient received was largely dependent on where they lived. And then there were system-level challenges such as lack of integration and coordination among different healthcare providers, inadequate funding, and policy gaps, all of which further complicated the pre-pandemic healthcare scenario. So what we had was a global healthcare system that, while it had its strengths, was fraught with challenges. A system where the ability to access, afford, and receive quality care was not a given, but often a matter of luck. So this was the state of global healthcare before the pandemic. But what happened next? As the pandemic struck, healthcare systems worldwide had to adapt quickly. Let's explore the initial reforms. The world was caught off guard when the pandemic hit, but it didn't take long for healthcare systems to spring into action. One of the first changes we saw was a significant expansion in telehealth services. With lockdowns and social distancing measures in place, face-to-face consultations became a challenge. So healthcare providers turned to technology, offering virtual consultations to patients, a change that not only ensured continuity of care, but also reduced the risk of virus transmission. While telehealth was taking off, researchers were working tirelessly to develop treatments and vaccines. Given the urgency of the situation, regulatory bodies like the Food and Drug Administration in the United States and the European Medicines Agency in Europe expedited the approval process for these treatments. This was a significant departure from the usual lengthy approval processes, demonstrating a nimble and responsive approach to an unprecedented health crisis. At the same time, governments across the globe were ramping up their healthcare budgets. The pandemic exposed the vulnerabilities of healthcare systems, many of which were underfunded and ill-prepared for such a large-scale health emergency. In response, countries significantly increased their healthcare spending to improve infrastructure, hire more healthcare professionals, and ensure adequate supplies of essential medical equipment and personal protective equipment. These were necessary and immediate changes that helped healthcare systems manage the crisis. They were reactive, focusing on addressing the immediate needs and challenges posed by the pandemic. But they also highlighted the need for long-term, sustainable reforms in healthcare. While these initial reforms played a crucial role in managing the crisis, the question that lingers is, were they enough? Could more have been done to prepare for such a global health emergency? These are the questions that have driven further reforms in healthcare, reforms that focus not just on reacting to a crisis, but also on preparing for future ones. These early reforms were reactive, aiming to manage the crisis. But were they enough? As the pandemic progressed, so did the reforms. Now the focus shifted towards preparedness. Our journey into the heart of the pandemic led to a realization. The world needed to be better prepared for health crises of this magnitude. This sparked a wave of mid-pandemic reforms, a conscious shift towards fortifying our healthcare systems for the unforeseen future. A critical aspect of this shift was the strengthening of public health infrastructure. The pandemic exposed the weaknesses within our health systems, and it was clear that robust infrastructure was fundamental to a well-prepared response. Governments worldwide began to invest heavily in health infrastructure. This included the expansion of hospitals, the establishment of dedicated quarantine facilities, and the development of advanced laboratories for swift diagnostic testing. The aim? to create an infrastructure that could withstand the pressures of a health crisis and bounce back more rapidly. Equally important was the need to increase the healthcare workforce. The pandemic stretched our healthcare professionals to their limits. There was a glaring need for more hands on deck, so countries started to ramp up their healthcare workforce. From doctors and nurses to lab technicians and public health experts, efforts were made to train and deploy more healthcare professionals. This was not just about numbers, but also about ensuring a diverse range of skills and specialties to combat a wide spectrum of health challenges. But it wasn't just about having more facilities and more professionals. It was also about improving healthcare delivery. The pandemic underscored the significance of efficient healthcare delivery systems. Telemedicine, home healthcare services, and community-based care became the new norm. These innovations aimed to ensure that healthcare services were accessible to all, regardless of geographic barriers or mobility constraints. The mid-pandemic reforms were a wake-up call, a call to shift from a reactive approach to a proactive one, a call to prepare, to anticipate, and to fortify. They were a reminder that preparedness is not just about surviving a crisis, but about emerging stronger from it. These reforms aim to prepare us better for future healthcare crises. But what about the post-pandemic era? The pandemic has left a lasting impact on our healthcare systems. Let's delve into the post-pandemic reforms. In the wake of the global health crisis, the need for a resilient healthcare system has never been clearer. This resilience comes from three key areas: restructuring healthcare financing, integrating technology, and promoting health equity. First, let's look at healthcare financing. The pandemic has highlighted the need for a robust financial structure that can withstand shocks. Now, many nations are reconsidering their strategies. They're shifting away from the traditional fee-for-service models and moving towards value-based care. This approach rewards healthcare providers for the quality, not quantity, of their services, encouraging better patient outcomes and more efficient use of resources. Next, we have the integration of technology in healthcare. Telemedicine has seen a dramatic rise during the pandemic, and its value is undeniable. Remote consultations, digital prescriptions, and online health monitoring have all proven essential in times of crisis. But it's not just about crisis management. These tools also increase accessibility and convenience for patients, making healthcare more user-friendly and efficient. Finally, there's the issue of health equity. The pandemic has exposed stark disparities in health outcomes across different populations. To build a resilient healthcare system, we must ensure that everyone, regardless of their background, has equal access to quality healthcare. This means addressing social determinants of health like housing, education, and income, and implementing policies that promote health equality. In essence, a resilient healthcare system is one that is financially sustainable, technologically advanced, and equitable. It's a system that can adapt to changing circumstances, respond effectively to crises, and ensure the health and well-being of all its members. These reforms aim to build a resilient healthcare system for the future. But how effective are they? It's time to evaluate. Have these reforms made a significant difference? The post-pandemic healthcare reforms enacted worldwide have undeniably made a considerable impact. They represent a seismic shift in our approach to healthcare, emphasizing preparedness and resilience. The most noticeable improvement has been the accelerated adoption of telemedicine. This technology-driven approach has made healthcare more accessible, allowing individuals to consult with healthcare professionals from the safety and comfort of their homes. It has proven particularly beneficial for those living in remote areas who previously had to travel long distances to access medical services. Another significant advancement has been the focus on mental health. The pandemic highlighted the need for mental health support, and the reforms have responded by integrating mental health services into primary care. This has helped to destigmatize mental health issues and made it easier for individuals to seek the help they need. But it's not all sunshine and rainbows. There have been challenges along the way. The rapid implementation of these reforms has led to some growing pains. For instance, while telemedicine has increased accessibility, it has also highlighted the digital divide. Not everyone has access to the necessary technology or stable internet connection to utilize these services. Similarly, while the integration of mental health into primary care is a step in the right direction, there's still a long way to go. There's a shortage of mental health professionals, and the demand far exceeds the supply. In terms of preparedness, while we've made strides, the reality is that we can never be fully prepared for the unknown. We must continually evaluate and adapt our strategies to ensure we're as ready as we can be for future health crises. In conclusion, the post-pandemic healthcare reforms have brought about significant improvements, but they've also highlighted areas that need further attention. They're not a magic bullet, but they're a step in the right direction. As we continue to grapple with the aftermath of the pandemic, these reforms shape the future of global healthcare.